Welcome back to Midweek Politics. I'm David Pakman, talking about health insurance and health insurance reform. Max Baucus and Kent Conrad, two senators, have written a Republican health care bill that even Republicans won't support. And Senator Jay Rockefeller has also rejected it. Here's Senator Max Baucus. By the way, I don't want to get emails saying that I said Max Baucus is a Republican. They wrote a Republican health care bill that even Republicans won't support. Take a listen to what Max Baucus said recently about it.
Our package makes clear that if you like your doctor, your health plan today, you can keep them. It delivers affordable coverage to tens of billions of Americans and reduces costs and expands options for millions more. It increases the focus on prevention and wellness. It begins to shift the focus of our health care delivery system toward quality of care provided, not quantity of services provided.
Okay, and then here he said, here is why this is even a remotely good idea, which very few people seem to think it is.
The chairman's mark I am releasing today delivers on these critical reforms. It delivers on the vision for meaningful health care reform, and I share with President Obama and millions of Americans of all stripes that goal. It meets the criteria laid out by President Obama, and it can achieve our common goals for health care reform.
Well, whoever President Obama is, it doesn't seem like this is going to be the right proposal. I could be wrong. I cannot believe, Lewis, how mangled this entire healthcare situation has been. I think the plan, here's the plan. I'm proposing a plan, Lewis. And it's too late for anybody to actually propose this plan because Barack Obama blew it by not having done something like this in the first place. And I've said the idea of just expanding who qualifies for Medicare and Medicaid. What if Barack Obama said, a lot of people here are right. It doesn't make sense to create entirely new plans and new systems. Kay Bailey Hutchison is right. Things are too crazy to make this new plan happen right now. So let's put healthcare, a new healthcare plan, a new healthcare system on the back burner. Let's think about it, and let's give ourselves 2 years to do it. What we can do right now without creating any new plans is we're going to do this. If you're 65 or under or over, right now you can get Medicare. Let's make it 55 or older. Okay, that's going to bring in millions of new people. It's going to show, it'll determine whether or not the system can actually handle this many more people. And Medicaid, I'm assuming Medicare is for 65 plus and Medicaid is for income related. Let's expand the income requirements for Medicaid. So you know what? If you make under $32,000 a year, it's not an absurd amount of money to be making. It's still tough to pay for healthcare in many of those cases. If you make under $33,000 a year, you don't automatically get Medicaid, but there is a system in place where you can get it if you can't afford healthcare. It's not going to be a whole crazy audit. It's going to be a very basic demonstration of needs. If you make under $32,000 a year, you can't pay for it. You can also qualify for Medicaid. We've just brought in millions of new people into the system. Not only is it right away going to have an effect, it's keeping the people that are saying we can't do anything new right now, not happy, but at least it'll keep them at bay. And if it works, obviously if it doesn't, it's a disaster. If it does work, it's a case study for Barack Obama saying, see, look, we expanded the number of people that get their coverage from the government by whatever many number of millions of people that is. That's proof that it can be done. It can be done. Now let's talk about reform.
Right. I don't think it's a bad idea. Maybe even expanding it by 5 years,
To 60 instead of 65.
What if it doesn't work? Do you reverse it? Then a lot of people might be in a lot of trouble.
Sure. Well, no matter how many years you expand it, the possibility of reversing it would always be there, I guess.
And I think a lot of Democrats have brought up the idea, and of all the criticisms we've heard, I think that idea was the least criticized by Republicans. Or so it seemed.